Hey guys, I'm Leah and I'm going to be talking about anthrax. So, just some quick facts about the bacteria. Its formal name is Bacillus anthracis. It's a gram-positive rod-shaped bacteria, and it's facultative anaerobic, which just means that it can live in areas with low oxygen concentrations, and then it also contains an endospore. So it can be transmitted through three ways. It's primarily zoonotic, but it can be transmitted airborne and then via direct contact. And this is just a picture that helps put all of that a little bit closer together. So with Bacillus anthracis, it rests in its spore form, which just means that it can live for longer. It's a lot more harder to kill in that form, basically. So it can live in the grass or in the dirt very easily, and then it can actually live really easily in sheep wool. So a lot of wool workers back in the day, they would be working with this wool, and then the spores would come out and they would inhale it, which is how they would get anthrax. And then a lot of grass-fed animals would also end up eating these spores, and then the CO2 and bicarbonate concentrations in the body would activate these spores, and that would cause them to be infected, and then anyone who ate these infected animals would also get it. You can also get it if there's a cut in your skin and that spore gets into the cut. It can cause you to be infected with it. And then there has been some studies done where there's fluid that comes from sores from cutaneous anthrax, and that has been shown in some cases to cause anthrax in other people. But there are 4 manifestations of anthrax, but with all 4 of them, you tend to see fever and chills and headache. But then each of the 4 have their own specific symptoms that help identify them. So for example, with cutaneous, you tend to see these sores and then black eschars. There's a picture on the next slide, but you'll get them on your face and your neck and then on your arms and your hands as well. It'll usually be just like this painless skin mark with black in the center. With inhalation, what you'll end up seeing is that you'll get these same sores, but on the inside of your lungs and then on your respiratory tract. And it'll make it very hard for you to breathe. You'll end up having a lot of chest pain. You'll be coughing a lot. You'll have confusion and dizziness, along with the fever and chills. And then in addition to that, with in the GI manifestation, you'll see those same sores on your GI tract. You'll also get stomach pain. You also see swelling in the stomach and then in the neck and the neck glands, which will make it painful to swallow, and then you'll also have nausea and vomiting and diarrhea. And then with injection's actually most common with drug addicts. You'll see it where there'll be a black sore or black eschar or the blisters near the injection site. So the way that you diagnose it is there's the hallmark eschar symptom. So that's usually seen. And then if it is the inhaled form, you'll be able to see that kind of damage to the lungs through a chest x-ray or a CT scan. They can also measure antibodies, and then anthrax itself, when it's activated, releases this very specific toxin. And you can measure that toxin through the blood. And then you can also just test directly for anthrax, which is usually what's done most often. For treatment and prevention, there's antibiotics are very effective against anthrax. There's antitoxin. There's not a lot of antitoxins that are effective, but that is a treatment option. Prevention-wise, you can use vaccines, and sometimes vaccines can also be used as treatment, which we'll talk about in a second. And then in a very extreme case of the inhaled form, you will have to go on a ventilator to help you breathe. But, so with the vaccine, what ends up happening is they only give the vaccine to people who are at risk for some reason of encountering anthrax. So this can include those who work in the military, any lab workers, anyone who works with animals that could come, mainly grass-fed animals, but anyone who comes into contact with animals like that. And then they'll also use antibiotics as prevention as well for people who have come into contact or have been exposed to anthrax but aren't showing symptoms yet. And they'll usually use ciprofloxacin or doxycycline. And the way that works is that after you've been exposed, at least within 6 days, you have to start taking the antibiotics, and then you have to take it for 60 days. And that's just because it takes about 6 days for the spores to be activated, but even then they can live in your body for about 60 days. So incidence and prevalence, it's around 2,000 to 20,000 cases per year. It's one of those things that's a little bit hard to track depending on where it is. There's usually only about 2 cases in the US. I want to say that the last case was in 2009. And that was from a woman who was working with drums. Like, she was making drums and she ended up inhaling some of the spores. But there have also just been cases due to people who share needles, people who share needles, like drug addicts. They'll, if anyone's infected with anthrax, you can get it from that way too. But it's mostly in the Middle East and Asia and Africa where a lot of people tend to work with those kind of grass-fed animals where the spores are just really easy to cling on to for them. This is just a really quick history of it. So, one of the first accounts of anthrax that they think is anthrax is actually it's in the Bible. It's the 10 plagues. So the 5th and 6th plagues, it's where the animals start showing up with sores, and then the 6th one, which is boils, they think that they were both anthrax, actually. But it's not until 1700 that you get your first clinical description of anthrax. And then Robert Koch in 1877 identified the causative agent of anthrax. And we actually learned about his postulates in class that he kind of used anthrax to help make. And then it's in 1881 that Pasteur comes along and he creates a vaccine that's really effective with animals who have been infected with anthrax, and preventing animals from getting infected from anthrax, which is like super great for the livestock industry from then on. And then in 1944 they start using penicillin to treat patients with anthrax, and ends up being super effective. It's not until the 1950s that you start getting a vaccine that is primarily for humans, and then we've just been working on it ever since and making it more and more effective. So recent cases of anthrax, like I said, there was a woman in 2009, and then there's also just been drug addicts, I want to say, is the last few cases. But along with all of this, it's been basically since the 1800s that we've also looked at anthrax and used it as a biological weapon. A really good example of this is in World War II, where we made like anthrax packets, basically, and we airdropped them near the livestock of German soldiers so that their livestock would end up getting anthrax, and then if people ate the infected livestock, the soldiers would also get anthrax and die. But one thing that Dr. Cody touched on in class is the anthrax mailings, so I thought I'd end with talking about that. So it was about a week after 9/11 had occurred. 2 U.S. senators and U.S. media on the East Coast ended up getting these letters. It's actually also on the slide. And it ended up leading into 5 deaths and 17 injured. And then they were able to activate the anthrax in their letters already, so they were already, ready to go, basically. So it ended up infecting people, it contaminated the postal service, and there were some people who ended up getting anthrax or were at risk of it because their mail had touched these letters. It ends up leading into this whole 7-year investigation where they're questioning all these people, and they're trying to analyze the anthrax sample and stuff. And as you can tell by the letter, a lot of people thought it was Al-Qaeda. It was actually this guy named Dr. Bruce Edwards Ivins, who, after 9/11, he had basically, so his whole life, he had dedicated to research of the anthrax vaccine. And it was everything he had ever done. And then, with 9/11 and everything else, with all the spending going into defense spending, his program was slowly getting defunded. And it was partly because we only have 2 cases in the U.S. every year. So the government was kind of like, oh, well, you don't really need this money. You don't need to do this research anymore. So he thought he would make it necessary for this research to happen. So after he sent these letters, his whole program ends up getting completely rejuvenated, and he gets all this funding to do all these vaccines and stuff, but he ends up getting caught because when they analyzed the anthrax sample, they find out that it comes from a very specific strain, like a very specific batch that was only at his research laboratory. And he ends up getting questioned and he ends up getting caught. But yeah, so it's the anthrax mailings, and that's it. So thanks for watching, and I'll see you guys in class.